Come to next topic, that is correction of correlation of ball changes with dysfunctional lens index. Dr. Manpreet Kaur from RP Center, AIMS.
A very good afternoon to all of you. I'll be presenting our study on correlation of wall changes with dysfunctional lens index and nuclear sclerosis after presbyopic phakic intraocular lens implantation. No financial disclosures. So the global unmet need for presbyopia stands at 45%. Surgical correction includes corneal ablative and lens-based procedures. Presbyopic phakic IL is a potentially reversible and safe procedure to surgically correct presbyopia. We now have in the market two commercially available ones, the Star Evo Viva, which provides up to 2 diopters of extended depth of focus, and the IPCL by KAUR Group, which is a hybrid hydrophilic acrylic refractive diffractive design. So our purpose was to evaluate the refractive outcomes, Walt, dysfunctional lens index, and nuclear sclerosis after posterior chamber presbyopic phakic IL implantation. It was a prospective interventional study on 48 eyes of 24 patients undergoing IPCL implantation at Dr. Rajendra Prasad Center for Ophthalmic Sciences, AIMS, New Delhi. The primary outcome measure was the uncorrected near visual acuity. The secondary outcome measures were uncorrected distance and intermediate visual acuity, Walt, dysfunctional lens index assessed by ray tracing aberrometry, and cataract formation with a follow-up of 5 years. Coming to the results, the mean age of the patients was 46.2 plus minus 3.7 years. At 5 years, the uncorrected near visual acuity was 20/40 or better in 75%. The uncorrected intermediate visual acuity was 20/32 or better in 100%. The uncorrected distance visual acuity was 20/20 or better in 100%. A significant improvement in total higher order aberrations and strain ratio was observed after presbyopic phakic IL implantation. The mean immediate postoperative Walt was 571.2 plus minus 241.2 microns. The Walt decreased to 342.8.7 plus minus 179.2 microns over 5 years with a significant p-value of 0.001. The dysfunctional lens index decreased from 8.38 plus minus 0.89 to 6.32 plus minus 1.21 with a p-value of less than 0.001. The decrease in Walt correlated with a decrease in dysfunctional lens index with a Pearson coefficient of 0.221 and a p-value of 0.027. Intraoperatively, inverse phakic IL implantation was detected in one case on table using AIOS2025. It was explanted and re-implanted in the correct orientation in the same sitting as well with no further long-term complications. Postoperatively, nuclear cataract formation necessitated phacoemulsification with phakic IL removal in 20% of our eyes, 6 out of the 48 eyes. The mean time to surgery was 22.3 plus minus 13.2 months with a dysfunctional lens index at the time of surgery of 2.1 plus minus 0.63. Just to highlight the case, there was a progressive increase in higher order aberrations with development of cataract at 1 year. So on the left hand side, you can observe the 1 month ray tracing aberrometry with acceptable higher order aberrations. These significantly increased for the total eye and internal, which correlate with the lenticular aberrations at 1 year. There was a progressive increase in dysfunctional lens index at 1 year from 5.56 over here to 3.49, progressive worsening. So just to conclude, the presbyopic phakic IL provides spectacle independence for near in 75% of cases, which is 3/4. A positive correlation was observed between the decrease in Walt and dysfunctional lens index over 5 years. Nuclear sclerosis requiring surgery was observed in 20% of cases within the initial 2 years, which was associated with a decreased dysfunctional lens index. So phakic ILs have been proved to be safe and efficacious in the younger age group for the correction of myopia and hyperopia. For presbyopia, they do provide a functional near vision. However, the age group is different from the ones undergoing refractive surgery conventionally, and there is a significantly higher incidence of earlier cataract formation in these cases. Thank you for a patient hearing.
Thank you so much, Dr. Manpreet, for a nice presentation. Any questions from the house? Dr. Ang?
So by appearance in the slit lamp, you differentiated the cataract to nuclear instead of the touching in terms of anterior subcapsular.
Because the touching would be, the location would be subcapsular, the nuclear would be in the nucleus.
Be differentiated in the eye trace. So just the
Yeah.
Yes, yes, on a slit lamp, yes.
These cases are more of a nuclear sclerosis, all of them, which is seen and slowly progressive and induction of a higher order aberration in these cases. We didn't have any cases with a subcapsular opacification in these cases also. And I think, these are good alternatives, but ultimately these patients will have early cataract formation because we are putting something, which is not clearly physiological. Thank you, Dr.